The government and health officials in Guyana on Friday said the Takatu River Bridge, which links Guyana's Letem to Bonfim in Brazil, will remain closed as part of precautions to guard against the spread of the new, highly transmissible COVID-19 variant, which was detected in Brazil earlier this week. With the United Kingdom already banning flights from several South American countries, including Guyana, over the developments in Brazil, Health Minister Dr. Frank Anthony has said that Guyana will put its own protective measures in place. During his daily COVID-19 update on Friday, the health minister said Guyana, like other countries, is particularly concerned that the virus was being regarded as transmissible. Dr. Anthony fears that if the strain makes its way into Guyana, which shares a large part of its unregulated border with Brazil, it could lead to a spike in domestic cases and crowding of hospitals across the country.
And if this is more transmissible, then more people are going to get infected. And if more people are going to get infected, then we can assume that we'll get a percentage of them, a higher percentage of them coming into the hospital, coming in from the hospital needing ICU care. So these are going to be the challenges if this variant circulates in our country. So it is something that is now being investigated. It's only been detected about 3 days ago.
The health minister said with Guyana's land border closed for several months now, heightened joint service patrols will continue along the margins of the two countries to guard against unregulated crossing. Guyana and Brazil allow for a once-weekly passing of goods between the two countries, an exercise that Dr. Anthony said is properly supervised by the health authorities on both sides.
So we are very concerned. And because of its proximity to us, we also must pay attention to that. Our land border has been closed for some time now. We haven't really opened our land border. So the bridge over the Takatu has been closed. We do allow on Thursdays very limited amount of interaction where goods come over from Brazil and goods from Guyana go across to Brazil. So there's a very limited interaction, and that is properly supervised by the health authority of both countries.
New variants of COVID-19 have previously been identified in the UK and South Africa, with many countries imposing restrictions on arrivals from both nations. Dr. Anthony said the World Health Organization also suspects that the new variant identified in Brazil a few days ago may already be in other South American countries. Felipe Neveca, Deputy Director of Research at the Brazilian state-run Oswaldo Cruz Foundation, said the new variant was of concern and its origin was undoubtedly from the Amazon region.